Vitamin D is essential for musculoskeletal and bone health in children, especially during the growing period. Hence, it's very important that you take care that the vitamin D is adequately supplemented when required. Vitamin D is less than 10% is actually obtained from the diet. Vitamin D is rich in fishes like salmon, tuna, mackerel, and other sources like egg yolk, liver may contain lesser amount of vitamin D. In some places, we may have foods which are fortified with vitamin D, but this constitutes a very less portion, that is less than 10% of the vitamin D which is obtained. More than 90% of the vitamin D is synthesized through the skin by absorption through sunlight. It is important that the child is exposed for at least 5 to 30 minutes a day between 10 a.m. to 3 p.m. most of the days of the week without any sunscreen for that to get absorbed in the body and get converted to vitamin D. Now, there may be many factors which also affect the absorption despite all these necessary factors which are taken care of, like a cloudy environment, pollution, application of sunscreen, darker complexion, genetic factors which affect the vitamin D synthesis and absorption, and so on. Apart from this, diet low in calcium or diets high in phytates and oxalates can also interfere with the vitamin D synthesis in our body. Fasting sample is generally not required while taking a vitamin D blood test. Even if you take it in the morning or in the night, it's not going to change the value, as diurnal variation does not alter the result. Routine testing of all children for vitamin D deficiency is not required. There are certain risk factors or conditions where the child may be prone for vitamin D deficiency. Those are the cases where the doctor will advise for testing for vitamin D. A lot of formulation, strength, and combinations are available in the market for vitamin D. Vitamin D is available in 400 international units, 600 international units, 800 international units. You have it in the form of a syrup, drops, tablets, mouth dispersible, chewable tablets, powder form, and so on. Then you also have it with calcium, with phosphorus and calcium, with other essential vitamins, minerals, and so on. So it's very crucial that you get the appropriate formulation, appropriate strength which has been prescribed for your child, and give that correctly. This is important because excess intake of vitamin D or wrong administration of the dose or the strength can lead to inadvertent toxicity of vitamin D, which is equally dangerous. Vitamin D toxicity can lead to excess calcium in the body, which can get absorbed in the blood vessels, in the kidneys, and excess excretion of the calcium in the urine also, which can lead to complications. Oral intake of vitamin D is actually helpful or better in normalizing the vitamin D level compared to injections. So, the most commonly prescribed route is always the oral form. Routinely, injections are not given. There can also be a risk of toxicity when large doses are given as injections. The only scenarios where the doctor may prescribe the injection are when oral intake is not increasing the levels, or there's an issue with the absorption through the gut, or so on. Vitamin D is a fat-soluble vitamin. It can be taken with the meal or even after a meal because it is independent of the absorption is independent of the fasting. Generally, you can take it with some fat containing liquid or fat containing food for better absorption. When you are giving vitamin D for a child, either as a treatment or as a prevention, it is very important that the child gets appropriate amount of calcium also in the diet. Otherwise, it may be necessary to give calcium supplement also. Calcium rich foods are milk, yogurt, cheese, seeds like sesame seeds, chia seeds. Then you have green leafy vegetables like kale, broccoli, spinach. Spinach, though being rich in calcium, it is also rich in oxalates, which can affect the calcium absorption. So, the amount of calcium that's absorbed may not be as much as that of other green leafy vegetables. There are certain periods when vitamin D supplementation is a must, like in the newborn period and up to 1 year of age. This is because breast milk is a very poor source of vitamin D. So, during this period till 1 year of age, it is important to supplement infants with 400 IU per day. If your child is born preterm, even in that case, they will have a higher requirement of calcium, phosphorus, and vitamin D. This will be supplemented by your doctor. This is a very common question. See, most of the formula milk may contain the 400 international units per liter of formula milk. Now, we don't expect the baby to take this much amount of formula milk in a day. So, yes, in spite of giving the formula milk, it is essential to supplement vitamin D in your child. Always follow the advice of your doctor. If you want more such information on healthy nutrition for your children, stay tuned and follow this channel for more such videos.